Hello and welcome to the Parent Survival Kit podcast, from surviving to thriving in your household. My name is Gene Schwalen. Next to me, as always, my beautiful bride, Dr. Sonia Schwalen, pediatric psychologist expert and nationally certified school psychologist. We have two guests we're completely excited to have on the show today. We have Nina Allen, and she's going to introduce herself, and also Patrick. Why don't you go ahead and introduce yourself, Nina?
I'm Nina Allen. I'm a board-certified behavior analyst, and I'm licensed in the state of Texas.
And my name is Patrick Moynihan, and I'm an administrative director at Excel Therapies, and I have the pleasure of working alongside Nina, as well as many other of our talented BCBA professionals.
Well, that's what I want to dive into. So BCBA, and what does that mean? And so today we're going to talk about, just kids, children who are on the actual autism spectrum, and really kind of dive into really what that means. How do we care for these children? How do we give support to families? I mean, we're going to cover a lot of just
how do we navigate services,
all kinds of things. So
put it all out there.
First of all, so what does BCBA mean?
Board Certified Behavior Analyst.
Just as you said before.
So, yeah.
And what's LBA?
Licensed Behavior Analyst. So
okay. And so what is a behavior analyst?
I analyze behavior.
There you go. So when it comes to behavioral analysts, it's really more dealing with children on the spectrum. Is that accurate?
That is. It's individuals with developmental disabilities.
Okay.
So
one of the things that, just from an administrative perspective, that's kind of evolved in the field is behavior analysis has incredibly broad applications, right? There's ABA for organizations, OBM or organizational behavior management, right? The application of behavior analysis has kind of been shaped by what insurance companies and healthcare providers cover, and so typically that's where we now think of the applied behavior analysis as mostly working with pediatric clients on the autism spectrum. But to Nina's point, you can practice ABA we can practice it on ourselves, right? It's a kind of an approach or a teaching methodology in a sense. Excellent.
Well, thank you for sharing that. So when it comes to ABA services directed towards individuals who are on the spectrum of autism, I know there's a lot of questions out there. So the first thing I kind of want to do, because I am a dad, and even before we actually started the show today, we talked about just how do we approach certain things with our kids. And so the questions I have, so I know that a lot of parents, when they find their kid has some type of disability, whether it's autism or anything else, a lot of times they question themselves like, is this my fault? What did I do? Did I do something wrong? And then there's also just the different thoughts about, does this mean my kid's not going to be normal for the rest of their life? Will they go to school? Will they go to college? Will they get married? Will they have a job? There's all these things and thoughts that go through parents' head, and that's going to be really, really tough for parents. So I want to kind of start with the parents first, because I think until they really can kind of wrap their head around and have the support they need, they really can't be all their children really need when having to manage some of these behaviors and whatnot with the spectrum. So.
Well, Gene, it does all start with the parents, but when we talk about services, I don't diagnose. So I always recommend that parents look to other professionals as well, because there's a lot of aspects that go into the initial diagnosis and the initial support, and it does take a village.
Yeah, that's a great point, too, because one thing that, I know Dr. Schwalen does a lot of assessment for autism. I know that there's a lot of clients that call into the Next Steps Worldwide intake line and just questioning, is their child on the spectrum? We have college students that go off to college, and all of a sudden they're questioning whether or not they may be on the spectrum and whatnot. And
what happens a lot, too, I just want to put this out there, is that children will get diagnosed with autism, and then mom and dad are calling us and saying, I have the same symptoms, or I didn't realize it, but now that my child got this diagnosis, I think this is also what's been going on with me for so long, and I would like an assessment to put the puzzle together.
Absolutely. And I think, again, as a non-clinician, but somebody who has an opportunity to talk with a lot of parents, a lot of what we need to do is just listen. I think what we're all saying here is it's called autism spectrum disorder for a reason. And so at the point where we, have parents set up a diagnostic evaluation with a clinical psychologist and go through that process, That's not a process to take lightly, right? I mean, it's something that we really want to chat with parents about. At the point where the parents, do have a diagnosis for their child, that's really the start of the journey, right? And so I think at that point, a lot of what we do as part of the functional behavior assessment process, it's a lengthy process, right? We can't do it in an hour or two. Sometimes our board certified behavior analysts, it'll take them a month or two to do the observations and the clinical interviews and generate the report. And so, like Nina's saying, there's a lot that goes into that. A big piece of that is just understanding what are the parent or caregiver or family's goals for this child. To your point about leading a healthy, normal life, what is the definition of healthy and normal, right? Is my child going to have an IEP forever? Is that the best thing for him or her? And so having some of those conversations to really understand, what is the focus of our service delivery model?
Yeah, and I guess the place to start first is, the diagnosis. Like, you actually have to have a diagnosis before you can go anywhere, or you really understand what the next steps really could be or should be initially. So,
And then if we're going to get super real, you said it's the starting point. We have to have the diagnosis in order to build the treatment plan to actually figure out what to do next. But it's also necessary for most insurance companies, when I'm doing the assessments and writing the reports for these families, I even have to write them in a very specific way just so that I can make sure that if ABA, right, is being recommended, applied behavior analysis, so that's ABA therapy, if that's being recommended, then the family will at least have the best chances of getting that service covered by their insurance company. So diagnosis in the beginning is everything.
Yeah,
absolutely.
Well, and we have clients that call in that have been diagnosed through the schools in certain ways, and they still need an actual clinical psychologist to give the official diagnosis before they'll even cover it. So, we have
pediatricians aren't even allowed to do that. They understand autism to a certain extent. They can recognize it when they see it, but they also have to refer to a psychologist to get the full assessment and diagnosis.
So what I kind of want to ask first is, because I want to kind of step into this in different ways, and you guys can go anywhere you want to go, but we're talking about a spectrum. So and the spectrum is like really broad, right? When it comes to autism, you have high functioning, you've got anything above that, below that. So why don't you guys kind of explain what the spectrum really looks like?
Well, I think it speaks to just how this has evolved over the last, I would say, 30 years. ABA specifically, the therapy has really changed a lot. But at the end of the day, it's hard to be a parent regardless, right? Let's just say that. And taking that first step to get that diagnosis is so important. And it takes a lot for parents to get to that point, and where they want to reach out and they want support.
Yeah, it's really difficult, right, for parents to even reach out, get support in that initial diagnosis. And then the really cool thing, like Nina said, is that our understanding of autism has evolved so much that we can even conceptualize or think about it on a spectrum. That just goes to show how much more people are starting to understand it, as it's not going to show up the same for everyone. And we have to consider different components of the diagnosis in different people, because people are individual, and we have to take an individual approach to treating that person as someone who deserves that respect and understanding of who they are and what that diagnosis shows up for them, right? So what you said is there's high functioning and then there's other levels of it. So it's really just talking about impairment, right? The level of impairment when compared to what we expect should be functional, right, in our society. Then we kind of like gauge how much is this person impaired. Even those words don't sound that good, right? I hate some of the words we use in our diagnostics of autism. But in terms of functioning, we're really looking at functioning. So how well is someone communicating? Where are they struggling socially? How much is that impairment? And then we decide how much level of support someone will need, okay? So it can look different for every single person who has an autism diagnosis. Some individuals are verbal, right? They're speaking to you fluently, and yet you kind of feel that there's a social difference there, or some kind of communication difference there. And then other individuals aren't verbal. They're still, really having a difficult time with developing just basic language skills, and they're 10 or 11 years old, okay? And so the level of impairment, again, in quotes, because I just really don't even like that word, but it's what's used in diagnostics, is what really determines where they fall on that spectrum.
I'm so glad you said that, because we often talk about support needs, and in every step of your life, those support needs are going to look different.
Right.
And when you have a developmental disability or any sort of challenge or deficit, it evolves as well. And one thing that I did want to point out is the actual diagnosis has changed, and so you can no longer be diagnosed, correct me if I'm wrong, with Asperger's.
Yep.
And so that's a common term that people have used a lot. And it goes to show that as we gain more knowledge of the field and the deficits in those functional needs, how the diagnosis actually changes as well.
Yeah.
Yeah, and one thing, go ahead, Patrick.
Oh, I was just going to add, I think it is. It's a fascinating conversation, because when you go and you look at the sort of medical definition of autism, it's a spectrum disorder. Typically with a medical course of treatment, if you have a bacterial infection, you prescribe an antibiotic, and that is the sort of cure, right, for that impairment. Here, oftentimes autism, you'll see that it's characterized by certain things, right? So communication deficits, as you alluded to, Dr. Schwalen, and social, emotional, and language issues and things like that. So when you have a disorder that's characterized by something, nothing we can do is cookie cutter. And that's a lot of why we want to provide those different environments, right? Going into a home setting or a community-based setting, generalizing to environments where the child is a little bit more familiar, offering center-based services, just because what's going to be, helpful for one child is not going to be helpful for the next, right? And that's a lot of the detective work that goes on.
And what you said about cookie cutter, I think, is going to really nicely tie into what I know we're going to talk about eventually on this episode, is even how ABA treatment has changed so much. Because back in the day, my day, it used to be so robotic and cookie cutter, right? And it's absolutely not like that anymore. And so I'm excited to be able to talk about that. But what were you going to say?
Well, I was going to just say, as far as the question I have, because I know there's a lot of clients that call into Next Steps regarding concerns about their kids potentially being on the spectrum. And we have parents calling in for kids that are not even 2 years old yet in a lot of cases. So what is really the age where you can really determine whether or not a kid is on the spectrum?
That's a great question. And so a lot of times we do get clients or parents who are calling in and their child is maybe 12 months old or 18 months old, and they're trying to be proactive because maybe the pediatrician has shared concern about some kind of developmental delay, and they just want to make sure that there's a pediatric psychologist involved who has eyes on the child. And so it's proactive, just developmentally, how can we support this child? Other times, parents are doing it on their own because they have other children who are on the spectrum. And they recognize the signs, right? They're much more alert to what they should be looking for. They see the signs, and then they want to be proactive themselves. And so, like you said, we don't generally diagnose autism until a child is at least 2 or older. If it's earlier than that, what we're doing is we're saying, let's give it some time. It's really normal for development to happen on a spectrum also. And so just because one 2-year-old is doing all of these things, it doesn't mean the next 2-year-old is going to be doing the same things at the same pace, at the same level of mastery, okay? And so early diagnosis of autism, it's important, but it's also something that a lot of providers will say, well, let's do a few interventions, see how they progress, because I'm not quite comfortable giving this full diagnosis yet until I can see how they respond to some of these interventions.
That comes down to like just functioning, right? I mean, kids function and they develop functioning, at different levels and whatnot at a young age. So,
And there's some families where we see a regression, and that can happen to where we refer to get that diagnosis because of a dramatic regression of skills. So they lose some skills, and we want to get on board with helping increase that skill acquisition again.
That's super important that you said that. I think diagnostically that's really important. We spend a lot of time as psychologists when we're doing the assessments talking about regression. So for parents, that are listening, if you don't really understand what that means, it's when your child maybe is talking just fine, they're 3 years old and all of a sudden they stop. They're not talking anymore. they're not making much eye contact with you anymore. That's what's considered a regression. So it's something they were doing, and now you're not seeing those behaviors anymore. Go ahead, Patrick.
Absolutely. The only thing I was going to add is those developmental milestones. It's something that all of our staff have to be trained on, and something that's important to know as a parent. And you can talk to a doctor or a clinical psychologist about it. One of the things that we've seen used with kind of great success is this modified checklist for autism in toddlers. It's called the MCHAT is the acronym for it, but it was developed, I believe, by 3 clinical psychologists. And we were fortunate to reach out to them. We actually have a version of it on our website, but you can, as a parent, if you just Google MCHAT, it'll come up. Your doctor can administrate it. But it's essentially 20 questions. And for toddlers, I believe it's 16 to 30 months, who would be too young to really be officially diagnosed. It's a good kind of rough questionnaire in terms of where is my child in terms of where he or she should be developmentally, and it'll give you, based on the score, if the child scores very high, no issues, low, maybe go and set up a follow-up with a doctor or a clinical psychologist, and then extremely low, maybe start in early intervention services. But there are some things short of an official diagnosis that parents can do just to maybe have a little bit more peace of mind as well.
I agree with that.
Absolutely. And you talk about it all the time, like you can, assess kids as young as 3 to 4 months old. So if you have any concerns
for
whatsoever,
developmental stuff, right?
That's kind of like knowing is half the battle, right? So just seeing some of these things and getting some support or some resources in the very early stages can be beneficial.
Absolutely.
So I want to kind of talk about the street that we've lived on. I've been there for the last 18 years now, and so there's a kid on our street that suffers from autism or has autism. And he's just from observations, we live in a neighborhood that the school is 2 blocks down the road. And so even like our 18-year-old, almost 18-year-old who's graduating now, I remember walking him to school every day, and whatnot through kindergarten through 5th grade. And we would come across this young kid at the time with autism, obviously, and his mom. And this kid was adopted, and just at different times, we would just see him just go wild and start hitting, and really, really abusive in the behavior. And my heart went out to this mom, and she was, I don't know how she could have even done it, because she was so calm and just did not respond. Just so patient. I'm like, man, she is like, she's got to be tight with God, because there's no other way that I don't think anyone can do that. And so when you see it, because you see those things, right? And that's kind of the fear I think parents have. And so I think it's important to kind of, hear those cries. I feel those for a lot of parents with kids on the spectrum. And, and there's a lot of kids out there that just with different disabilities and whatnot. And again, as we talked about earlier in the show, just, is it my fault that I do something, it reminds me of John chapter 9, verse 1 through 3. And they talk about the disciples like, there's a blind man they come across, and, what happened is because of sin. Did this man's sin or his parents' sin? Is it the reason why he's blind? And Jesus replies, no, it's for God's kingdom and for his glory. It's for a purpose. And God puts those things in our lives for certain reasons. But I think it's important for us to really understand some of these things that parents are going through. We went to Fort Lauderdale not too long ago, a couple of weeks ago, for vacation with our family. And on the way back, we flew there. And so flying back, we were in the second to last row, and there's 6 of us. So it's me and Dr. Schwalen and our 4 kids, 17, 8, 3, and almost 2. And so we thought, we're like, wonder what the plane ride's gonna be like with us 4 kids. And we even had an experience on the way there. And this is how people respond with kids sometimes. On flying out there, there was a gentleman that actually paid for a seat that was right next to me, Dr. Schwalen, and one of our other kids. And he's like, I'm not sitting there because I have to. And I said, well, we'll trade seats if you want. He's like, he wanted the window seat that he paid for. And I said, well, you can have this aisle seat over here or across the way and not be by the kids. And he's like, those are my options. I either get the window seat or I get the aisle seat. I pay for the window seat. I want the window seat. And
I didn't pay to sit next to a bunch of kids.
And then he was like really upset. It was but I understand sometimes with kids and whatnot. So looking at our young kids, and of course you hear all the crying kids on the plane. On the way back though, the very last row behind us, there was a family, a mom and dad and 2 girls, and one girl was a little bit older. I'd say one was probably about 6, and the other one was, I don't even really know, probably 12, 13. but she was definitely on the spectrum, and she'd have these loud outbursts and just would, I mean, her parents were so patient, and she actually had a therapist that actually had to travel with them. They were actually living from Florida, and they were traveling to California for vacation.
Sure.
And so it just, I mean, managing that plane ride was very difficult for us. And we, you know, just because of the things that were going on and being on a plane, I just, you know, again, my heart goes out to these parents and how they actually are able to be so patient with these, you know, with these kids, with these challenges. It's really amazing.
Yeah, I know. We thought we had it rough. 2 toddlers on an airplane. It's like, no, this is nothing.
Some good perspective. And Nina, I don't know if you maybe want to talk about, like, you know, those are a lot of the things that we're working on oftentimes, right? So this spectrum, you talk about, you know, maybe kiddos who are a little more mild on the spectrum, moderate to severe, and some of what we work on in addition to skill acquisition, which is more of like the self-help, self-care, tying shoes, putting on clothes, eating, feeding, etc. We also we can assist with the maladaptive behavior reduction. Maladaptive is just a fancy word for not super desirable, right? So behaviors we want to reduce. I don't know if you'd like to.
I generally don't like calling them problem behaviors. I'm going to do my quotes because, they're not necessarily always a problem. And so I want to go back to the support needs. That mom, her journey is probably so beautiful, and I would have liked to, really know what it's like in the day of a life of a mom. My total respect goes to any mom. And so I want to go back to the functional behavior assessment.
Yeah, and really quick, that mom that we mentioned, I mean, they're still living down the street. He's probably, in his young 20s now. And he's, they have behavioral therapists or analysts or whatnot that come daily to his house, and they'll walk. We see them walking every morning, every afternoon, every night, like making laps around the neighborhood and whatnot. So it's a long journey. It's in some cases a never-ending journey that parents have to go through, right?
Right. It is a lifelong journey. I've been fortunate enough to work with a lot of adults and doing vocational services and quality of life services in day habs. And so it's given me a really great perspective. We talk a lot about early intervention. Early intervention is a really hot topic right now, right? But that wasn't always the case. And kids grow up and they grow older. If we can be so fortunate to be on this journey with them and support them, I think that the services right now have really, really evolved to maximize potential in any individual. So.
Yeah.
And kind of moving away from, a lot of the, I'm sure you've found as well, like ABA as a field is full of lingo, right? It's a very jargon heavy field. And so you hear terms like, punishment or reinforcement or things like that. And oftentimes those, those operational definitions, from a clinical perspective have a different connotation than they might to, myself as a layperson, right? Or a family or a parent. So, a big component of what we do, as you alluded to, Nina, is that that parent coaching or that caregiver training, right? Our goal at the end of the day is to, give parents and caregivers the tools that they need to really become that behavior analyst or that behavior technician and start generalizing, because at the end of the day, even if we're spending 10, 20, 30, 40 hours a week with these kiddos, it's still the minority of time during the week. And so for parents to be able to catch that vision and have those tools and resources, that's where we really start seeing things take off. And that's, like you said, it's a very exciting journey.
Yeah.
What does the mom do on the plane, or, when behaviors happen in a grocery store? I myself have been in Target, I don't even know how many times, and you're just like, oh my gosh. But
yeah, we have it with our own kids sometimes, right? I mean,
right?
It's any kid,
We
right?
had it this morning.
Yeah, we went.
Toddler,
Yeah.
right?
And we're outside in the farm, and we have it with our toddler. I mean, and it's kind of these parents on the plane to kind of go there for a moment. The cool thing about them was, and we were actually just admiring them. A lot of times they just ignored it, And one thing I want to mention, I kind of got biblical for a second, but if we all really look at it, all of us have our strengths and our weaknesses, every one of us, but we're all made in the image of God. We're all His special creation, and it was purposed that way for a reason. And so thinking about the girl on the plane as an example, one thing that we saw through some of the things that were like, oh my gosh, and it's got to be difficult for them, but now we're also having to experience it as well. So it definitely gives a great appreciation for it. But there was like one time she was sitting there talking, and the girl mentioned, well, I'm just really tired because I was up all night. I was texting my mom all night, just telling her how much I love her and how much I love her and whatnot. And that's so beautiful. Like, there's so many good moments. It makes me think of Atypical as an example of the TV show. And we really enjoyed that show because the kid was so funny. I mean, all of our kids are just different, and there's something that's beautiful about everyone. And it's just, all kids shine, and some kids are just, challenged in different ways.
We can do a whole nother episode on the neurodiverse movement.
Yeah, there you go.
But no, it's seeing that and seeing how much grace that they have, and they must have had a really great ABA therapist that taught them how to plan to ignore.
and just to say too, I think that's part of the neat science behind it, is really understanding, what is the reason for those behaviors, right? Our behavior analysts and our staff will talk about the ABCs, and Dr. Schwalen, I know you're deeply familiar with that, but understanding what is the genesis of behavior, why is that occurring? And sometimes it's, I want the toy, or, if you're in Target, it's, I want the candy bar, right? And so what do you as a parent do, and learning just better strategies for how to handle that in a positive way, that sort of, aligns things, in a more effective manner. So it's a great point. And I think, especially as kids get older, our goal is really to give them the option, right? We are all made in the image of God, like you said. And so, with pragmatics and with social skills and things like that, it's really to say, hey, here's, if you want to, be in your class and make friends, whatever, we can teach you effective strategies for doing that, but you don't need to fit yourself, as a square peg into a round hole, right? That's not what we're here to do. So I think that's a really important point that you brought up as well, Gene.
Yeah. So go ahead.
No, we way back when, in the old days of ABA, right? We're not creating tiny robots, and no two child is the same, and so it goes back to that individualized approach. And what can we do as clinicians to evolve with the field as well is so important. We're no longer sitting at the table doing 40 hours of just trial after trial after trial. It's, no, let's go where the learning happens. Let's go in the natural environment. Let's play. Let's get back to the play. And so I think that's what I've just had such a great pleasure of getting away from that trial-based, very clinical approach and seeing individuals just shine.
Yeah, well, that's a great point too, because I mean, obviously, a kid can spend 40 hours a week in clinic or in center doing these trials and whatnot, but when they get home, it's a completely different, atmosphere and whatnot, and parents really need to know how to help their kids the best way possible in the everyday interactions they have and whatever environments they're in, right?
So let's talk a little bit about ABA. You've been alluding to it now this whole time. So let's jump in. So talk to us about ABA. What should parents expect? Okay, they come to see someone like me. They get the diagnosis. Insurance is going to cover it. ABA is generally one of the gold standard treatments for autism. So most psychologists are going to say, let's start there, right? And now they come to someone like you. You're the ABA therapist. What can they expect?
Even before they come to me, they generally go through an intake process with any company that they go through. And getting that funding is something that parents aren't really well versed for that challenge. Getting ABA covered can be a whole hurdle that they may need to seek other support. And I've seen in my profession that when parents are supported from day one, when they come to a company or to come to seek help, it doesn't just start with me. It starts with the person that is on the phone that's helping them navigate this whole insurance world. It's unfortunate that parents have to fight so hard for services a lot of times. And so when they get to the assessment process with me, they've already gone through so much and just trying to get there. Most companies have waiting lists. Fortunate enough that we don't. And we really try hard to support, whether it's with us or another provider. I refer out so much just because I may not be that one provider that's going to help that family to the maximum potential. And I recognize that. I think that that's a really important thing as clinicians to know where's our scope of competence. But when they come to us for that assessment, it can be a lengthy process. And parents also aren't prepared for, okay, well, I got the script for ABA. Let's get started. You know, they want to know, okay, when is this behavior going to go away? When are we going to get back to whatever their normal is that they want? And as we've seen with COVID and everything, everybody's normal is shifted a lot. But one thing that I wanted to kind of educate is that parents, when they go to seek services, they can be met with lengthy wait times. It can take a long time to get insurance to cover it, ABA, and then it can take a long time for the assessment to happen. To get in the door day one with therapy could take a month or so.
Sometimes even longer, unfortunately, because even just to get in for an autism assessment at other clinics, not at Next Steps, because at Next Steps we don't have a waiting list either. So that's kind of cool.
Awesome.
But other clinics do. And sometimes those wait lists are, 3, 6, 9, 12 months long. And parents have no choice but to just wait sometimes. So,
And time is so important. You've gone this far as a parent to seek the help and to get the diagnosis. And then it's that hurry up offense, right? But I also want to encourage families to also look at other providers as well. I encourage families to go take tours at other clinics and to speak with other clinicians, because you have a choice of your provider, right? And you may, one thing may fit for one client and it may not fit for another. So,
right.
I think it's a great point. And I think, just to talk a little bit about like ABA, just like you wouldn't, you probably wouldn't go to the first pediatrician who pops up on Yelp, right? I mean, to do your research and make sure you have an ethical provider. I think a lot of times, unfortunately, there's this sense that a diagnosis of autism is like the key that unlocks all these services, right? Even though ABA has a broad application, Anthem or Blue Shield or whatever is only going to cover it if they have this autism diagnosis. And so to make sure you find an ethical, clinical psychologist who's only going to give you that diagnosis if you're supposed to have the diagnosis. And to your point as well, I think, just really, taking the time as a parent or caregiver, this is a pretty intensive service, right? Your child's going to be spending anywhere between 8 to typically 30, 35, sometimes in extreme cases, 40 hours a week with this company and this provider. So, evaluate the entire team, right? Make sure you understand who your behavior analyst is. I think just if I can, to touch briefly on the structure of services, right? We talked a lot about the assessment. Why does it take so long? So typically the first appointment after we do an intake, and I'm so fortunate I get to do a lot of intakes and talk with families and parents, but we're gonna have an evaluator really take you through that process. So the first FBA or functional behavior assessment appointment is something we call the clinical interview, and it's kind of just that. We want to sit down with you as the parent or the caregiver. We want to understand your goals. We also want to understand medical history and other supports that the child may have, right? If the child's in speech and OT and has an IEP and physical therapy and social skills groups and this, we're not going to burden that child with 40 hours of structured time, right? We need to really take all those other services into consideration. So that's kind of the goal of that clinical interview, is to set the tone. Is that a fair way of saying that, Nina?
that's a perfect way.
Right? And then from there, what we're going to do is kind of establish a baseline for some of these behaviors. So whether we're working on skill acquisition or whether we're working on the behavior reduction, understanding where we're at right now. And so everything we do is very data driven. It's very empirical. I think that's why it works, because we're making, real decisions based on data that we're taking day in and day out. So the behavior analyst is going to sort of create a baseline of those behaviors, and that can take 1 or 2 or sometimes 3 sessions. And then after that's done, they'll generate a report. So similar to how you'd receive a diagnostic evaluation report, you as a parent or caregiver, if you're getting ABA out there, you should expect a nice thick packet, right? I mean, these reports should be chock full of not just the baseline behaviors, but deeply detailed care plans in terms of what these behaviors are, exactly the programs that we're running. Again, nothing should be cookie cutter, right? So if the program is for tying a shoe, you should be able to really understand how we're going to break that down into bite-sized components and help your child learn to tie their shoe, right? And then from there, typically, treatment will begin. So at that point, I don't know if you want to explain, but the behavior analyst and the behavior technician, how that all works together.
I just wanted to point out that I love doing the intake part of it as well, because that's when that individualized approach really starts. It's where you're really learning what the family and the individual needs. And then you develop the program even before you get to that behavior part. We talk a lot about behavior, but it's getting that whole picture of, have they had ABA before? What are their challenges in home? Do they have more challenges in school? Do they need help with more other providers with food or anything like that? And so I really enjoy getting the backstory essentially, because that assessment is pretty thick, and I say that I write these though for insurance companies, and I always give that kind of disclaimer first. So
you mentioned the clinical intake. It's going to be a clinical interview. I think it's very important for the parents at the same time in this interview to really kind of be interviewing in some aspect the actual provider, because it's about that relationship and really feeling comfortable with that provider, especially if your kid's going to be spending this much time, with this team. You have to have a relationship you really can count on and believe in. There's a lot of, centers out there that are more focused on the dollar that comes in from the insurance company. So if you're not going to do 40 hours, we have a waiting list for you, or we're not going to see you, or, not really so worried about the occupational therapist or the speech therapist and all the other components. We talk about on the podcast all the time that it takes a village to really make a difference with a child. And that's true for a kid that has challenges and a kid who doesn't have all these other types of challenges necessarily. It takes a village. So
absolutely. I love all the questions that I get when I give tours to families. That tells me how involved they're going to be. And I encourage those questions. Ask all the nitty gritty questions, because if you're going into a center and everything is very secretive and very hidden, then that's not transparency. And that's something that I'm so thankful that in my practice that I have been able to be fully transparent. These are your medical records. You should have a copy of everything. You should be involved, and you should see the progress. We're also thankful with the digital age that parents can actually see the skill acquisition and the progress day to day with these therapists.
Yeah, that's awesome. I think that's really important too. Just being transparent. I mean, I think parents need to understand too. Like, you want a provider who's going to be, 100% real with you, even telling you things you may not want to hear. That's the truth, right?
So let's just break this down a little bit more, if you don't mind. So imagine that, I send a client over to y'all, and from now on, the only recommendation I'm going to write is y'all need an FBA. I won't even tell you how many hours this kid needs or whatever. That's your decision. You guys collect your data and make that decision. But after that, right, parent has no exposure to what ABA is whatsoever. Can you guys give examples of maybe what bad ABA is, and then what good ABA looks like, and how parents can distinguish between the two?
It's a great question.
That is a great question. It comes down to whether or not the services are going to be in center, in home, or community. I kind of look at that first. And if they're having a treatment recommendation of 40 hours a week, we typically look at the intensity of services that we're going to be providing. And parents aren't educated as far as who's going to actually be working with their child. I know we've mentioned a couple of times about registered behavior technicians. Those are the therapists. They're overseen by the BCBA. They're going to be the ones that are going to be implementing that treatment plan. We are also fortunate enough to have great case managers and caregiver support. And so it's a multi-tiered approach that you're going to have that support when you go in. Your treatment plan for your child will have a breakdown of all of those hours and what that's going to look like. So when we say 40 hours, it's not 40 hours with that therapist. It also involves looking over the treatment plan, parent training, parent coaching. It may involve some group skills or group therapy time. And then it involves a lot of updates and program updates because we want to make sure that we are looking at the progress.
Yeah, and exactly. Just to build on that, I think we have a BCBA who would say bad ABA is bad for you, and I think just to really talk directly to parents and caregivers out there, like not all ABA is created equal, and I know you've alluded to that, Dr. Schwalen, but because it's a relatively new field, there's a really large continuum of quality out there. And so I think one of the things you'll see is there are a lot of big, bright, shiny organizations, national and regional organizations that spend a lot of money on marketing and have taken outside, financial dollars, right? I mean, unfortunately, while clinician-driven organizations like us think of children as individual children, there are companies out there, and parents, do your own research, who don't feel that way, right? You alluded to this, Gene, but the almighty dollar and the fact that why would I recommend 20 hours a week if I can recommend 40, and that's essentially doubling the billings to insurance. So I think in terms of being really cautious as a parent, this is a very intensive service, and because it's a newer field, it's also less regulated and licensed, right? I mean, just to talk broadly about the field, if you go and see a speech pathologist, every state in America licenses their speech pathologist or their clinical psychologist. And so they're both board certified by ASHA or whatever the professional board is, but they're also licensed by the state. They're a licensed professional. Texas is a state that licenses their BCBAs, which is why Nina's not only a BCBA, but an LBA. But in California and Idaho, for instance, it's just that board certification. So, these BCBAs and these individuals are not necessarily licensed. And again, because it's a newer field, there's relatively less regulation from everything from what the treatment plans should look like to the supervision requirements, right? If you have speech therapy, you may be seen by a speech pathologist or a speech pathologist assistant, but states and the boards are very specific about those requirements, right? It's 2 SLPAs to every SLP, right? So they're really keeping the quality control tight. There are currently, to my knowledge, no regulations in terms of how many behavior technicians a board-certified behavior analyst can oversee. If they're registered with the board, an RBT or a registered behavior technician, they're required to have 5% of their hours supervised, but that's 5%, right? That's not half, it's not 75%. So you really, if you're a parent, I would encourage you to ask questions like, what does your training program look like, right? Behavior technicians, although our BCBAs and our case managers are at least masters and sometimes doctoral level clinicians who are highly skilled and highly trained, theoretically, a behavior analysis company or an ABA company could go hire somebody off the street or somebody who has no healthcare experience, put them through a 40-hour training program and call them a behavior technician and send them out to your child, right? So those are just things, frankly, red flags and things to be aware of as a parent. I think a lot of parents just assume that this is a highly, regulated field, and it is becoming that way. But really, it's critical as effective as the services are. Do your research and do your homework. And I think some of those questions to ask are, how are your behavior technicians trained, right? How do you think, what's your service delivery model, right? Do you have case managers? How many, behavior technicians are overseen by one board certified behavior analyst? So those are some proxies for quality, right? In addition to go ahead, please.
Just how many behavior therapists are going to be working with your child on a day-to-day basis, on a weekly basis? What is the turnover like? Because the revolving door, unfortunately, bad ABA at some of these companies, and you want a secure team. You want to be able to have that support and know who to go to, and that starts all the way down at the behavior therapist level. Before RBT, registered behavior technician, you could just go and get a job as a behavior therapist. And so that's just a title that people throw around a lot. And now, as we're evolving, Texas recently, in the past 5 years, did the licensure. So we are regulated by TDLR. We are regulated by the board, the BACB. And we do have to adhere to guidelines. And So that's a great question to ask is, are your therapists registered? And how many BCBAs? How many BCBAs are on site? And what is their caseload? What is their caseload? Because that's something that can really, really affect your child's progress, is whether or not there are too many clients under one BCBA.
So I guess as a parent, like one of the last questions I want to ask is, as a parent, and I know it depends on really recommendations and going through that assessment and really that could be over a couple of months or a certain time frame. But if my kid needs 20, 30, 40 hours, is that going to be a combination of in-center, in-home, group? I mean, is it a combination? Because I know that I see a lot of therapists in the home. But is it kind of a joint effort?
That's a great question. Some clinics will offer only clinic-based services. I am a firm believer in hybrid services, and so we offer support where they need support, and whether that is in the community, in Target, at a water park, or in the schools, or
traveling on vacation.
Exactly. There's a lot of great organizations that do support individuals with disabilities going on vacations. And so that's a really, really cool way to help out.
Excellent.
So let's, just to get kind of juicy here, I know you have a lot of experience working with clients. Give me an example of some bad ABA, right? Let's just put an obvious example out there.
Well, I want to, since you brought up bad ABA, I want to bring back, because we had lunch yesterday, and Patrick, and you talked about someone that, a client you came across or whatever. I just remember the shot collar, so I forgot everything else. They got shocked when you said that, but, shot collar therapy for a kid, that has autism.
Well, it's yeah. I shouldn't be laughing. It's not funny, and I think that's where a big part of, I think, our mission and our mandate is education and access, and only then therapy, right? I think a part of what we want to do, we put this on our website, is educating folks to the resources available to them, right? If funding is an issue, let us help you navigate that, right? If you're on a waiting list for 6 months, don't be on a waiting list for 6 months, right? Some things like that. And a big piece of that in a state like Idaho, and that's where that occurred, and we do have a location up there, is a lot of parents need that educational component, right? To just understand, why is a certain service more evidence-based or more effective than a non-evidence-based service? I think common sense plays into this quite a bit, right? If somebody's putting a shock collar on your child, run the other way, right? With your child, take them out of that situation. So I think that's a big piece of it. I think the other piece is access too, right? Making sure that folks have access to these services, right? So promoting, we work a lot with Medicaid clients, right? In some of the other states. And so just kind of doing our part to make sure that, parents don't have to make difficult decisions about whether their child can receive ABA or not, and only then kind of focusing on treatment. So a lot of it comes down to, I think, common sense, right? And then other things like metrics of quality are huge. Things like, it sounds like a basic, silly thing, but is everybody on staff, background checked, criminal background checked? Do we know everything there is to know about an individual who's going to be working with your child, right? I mean, these are sort of small things, but things that you'd be surprised you really do need to ask.
My first love is actually OBM, and so it just goes to show on ABA and how many fields and disciplines.
So you're talking in letters.
Oh,
Our
sorry.
audience doesn't know what you just said.
Organizational behavior management.
There you
go. And so you talk about access, and what parents sometimes do at clinics is you drop off, they go behind a closed door, and they don't have access. I welcome families to come and sit in the sessions and to really get that outside of parent training, see what we're doing on a day-to-day basis. I think that's really important, and in knowing what's going on.
I would also just say too, coming back to the common sense thing, a lot of what we see is, unfortunately, and this happens a lot with bigger companies, are decisions for your child being made by clinicians or by people who have something to gain financially from that, right? And you should, as a parent, or a caregiver, ask those questions, right? If your child is recommended for 40 hours a week, that may sound like a great thing. A lot of parents that I talk to during intake process, it's like, I want as much as I can get.
Relief,
right?
In some cases too, right?
Absolutely. But then how many discrete programs and interventions are you running, right? Look at the care plan. How are you utilizing 40 hours a week? that's a lot of demands to place on a child, right? And it's only appropriate in certain cases, right? So, if something doesn't check out or something doesn't make sense, initially and still to this day, a lot of our clients are folks who've come from other ABA organizations and are really fed up or, kind of disenfranchised with services overall. And so I think oftentimes really pleased to see, hey, ask those questions. We want to be transparent. We want to promote that interaction. There's nothing, you could probably attest to this, Nina, like our BCBAs are talking all the time about what a relief it is when parents want to participate, when parents really take an active stake in their child's progress. And that's a huge determining factor in terms of the long-term success of what we're doing.
Absolutely. Parents that are involved it's going to be key to the progress. And I was also going to say that just families in general should be involved. If they don't get an opportunity to look over a treatment plan before that treatment starts, that's a huge marker. It's a huge red flag. They should be involved in what programs are going to be run. At the end of the day, this is, they do have a choice in that. And so a lot of providers, I hear a lot from families where they're not able to take that involved approach where they can see the programs run or have input on what gets taught. And they have a choice.
It's really good to hear.
Yeah, absolutely. I mean, it's going to be obviously it's going to be really a life-changing situation in some cases that affects the entire family. So the family really needs to be involved, have that support, resources, and all that to really to move forward in a positive way. So,
and one last thing, if I could, just on that point, is just have expectations, right? Have expectations of us, because at the end of the day, a lot of scientific approach, we get caught up in the numbers, right? The quantitative and standard deviations, and they'll show you the numbers on a progress report, but also look at the qualitative factors, right? If we've been working for 6 months trying to teach your child how to tie their shoe and they're not tying their shoe, ask questions, right? And our hope is that qualitatively folks start to see that really significant progress, both whether we're working on skill acquisition or whether we're working on those maladaptive behaviors being reduced. The proof is in the pudding, right? And I think that's really critical. If you're not seeing progress, don't allow somebody to explain that away, and really look for those results for your child and for your family.
I like that, expectations and accountability, because as clinicians, we can just go back to the juicy, the old school BCBAs, right? Just old school professionals that are very stuck in their ways. I hope that parents and families are constantly having that expectation of me that I will evolve with the field as well.
Sounds good. Well, there you have it. There was a lot of great information today about ABA and autism and whatnot. So I know there's a lot more we could probably go into. And so I think it'd be great to have you guys come back and join us again for another episode. And we really appreciate you guys coming on today. So if you have more questions, you can always, put those at the bottom of the podcast. And we'll definitely respond to you. And if you need resources, we can definitely get with Nina and Patrick and get you guys taken care of in that area. But thank you again for joining today. The Parents of Alpha Kip, from surviving to thriving in your household. And we will see you next week.